Good afternoon, Mason and Pierce Middle Schools. It's Mrs. Shanahan again, and I'm here with Julia Aronica, and she is the director in Blue Cross Blue Shield of Michigan and the outreach program. How are you doing today?
I'm doing great, thanks.
Good. So, what is exactly do you do in your job?
So, what I do in my job are I have 50 people who work for me who go out into the neighborhoods, at least before COVID they did. Now they do things by phone, and they look for people in our data who haven't had their recommended health services.
Okay.
So maybe they haven't seen their doctor in a few years, or if they're diabetic, they haven't had their labs, or they may have not had their breast cancer screening. And we contact them and we set up appointments with their doctor, and we arrange transportation for them, which is covered, and generally assess what types of needs they have. So they may also not really have any food in the house, so they need to find a food bank, or a person may be facing homelessness, and we'll connect them with a resource to be sure they have a roof over their head. So we do all kinds of things for our members.
Okay, so this is Blue Cross Blue Shield, but it's also with Medicaid, correct?
Right, the name of our plan is Blue Cross Complete, and
Okay.
it's the Medicaid plan for Blue Cross Blue Shield of Michigan. And so all of our members are people who are living in or near the poverty level.
Okay, so these are important outreach services
absolutely.
because some people cannot get to the doctors
Right,
to have those tests run.
exactly.
So many of them, it could be saving their lives.
Oh, yeah, I definitely think we've saved some lives.
Yeah, for
Yeah.
sure.
Yeah.
So how did you get into this field?
Well, a little circuitous route. I'm a psychologist, and I had a private practice, and then I got more into the business side, and then I started working in managed care, and then got with a managed care plan, and so my career kind of evolved.
Okay, taking it from that way.
Yeah.
So what other kinds of things does Blue Cross Blue Shield? Because many people think Blue Cross Blue Shield is just health insurance. But there's more to it than just health insurance.
There's lots of exciting careers available through health insurance plans. First of all, there's always a big finance area, and that would include actuarial people who really assess the risk of how much the plan has to pay out in claims for care that people get versus the amount of the premiums or money they have coming in to pay for the care.
Okay.
And so that's an ongoing practice. We have physicians, nurses, we have social workers, people who pay claims, people who do customer service, our large outreach staff. We have attorneys, people who work in the compliance area, people who, do data entry, and a huge IT staff, and people who are know about medical economics. So, what is the cost of providing care versus maybe the amount of money you're taking in at the company. And then also just analysis around like how many people with diabetes do you have in the plan, and we have a big quality improvement staff. So just about any career that you could choose, you could find a very well-paying job at a health plan.
Wow, and I would never have thought about that. I would have thought just health, customer service and
Yeah.